Hi, I'm Josh Mancuso. I'm here with Dr. Amit Vashist and Jamie Swift from Ballad Health. Guys, thanks for joining us today. Tell us, what is the novel coronavirus, also known as COVID-19?
So the novel coronavirus is a new strain of the coronavirus that has never been identified and that has not infected humans. It seems to have originated in China, I think, as most people have known, and it's now really spreading across the world.
And so what are the symptoms that people experience when they have this virus?
So people with the novel coronavirus may experience symptoms that are consistent with mild to severe respiratory illness. Some of the symptoms that people may experience are fever, cough, shortness of breath, muscle weakness, those kind of things.
And when do these symptoms begin?
So right now, it really looks like 2 to 14 days based on what we know. Like we said, it's a new virus, so information may change, but right now the incubation appears to be around 2 to 14 days.
Okay, and then how does the virus spread from person to person?
So it's through droplet spread. So, those when you cough or when you sneeze, if you don't wash your hands after that, you contaminate surfaces. So it's really that person to person through that droplet spread.
And it's in the United States now. The virus has made it here, and so what do you know about that so far?
So the first case in the U.S. was January 21st. We have seen cases since then. We do expect to see more cases as the virus spreads.
Dr. Vashist, how is the novel coronavirus or COVID-19 different or more severe than the seasonal flu or the regular flu?
Right now, we don't know how contagious or dangerous the COVID-19 is compared to the flu. We don't have much data from studies that are coming from China, where the first outbreak happened. The mortality rate or the death rate has been shown to be about 2%. The symptoms, what we do know is, have been shown to be much more severe in elderly patients with other medical comorbidities.
Okay, and is there a vaccine or any kind of treatment at this point for the novel coronavirus?
Unfortunately, there is not a vaccine yet. It is in the stages of testing and subsequent development, so it may be many months before we will have a vaccine against the novel coronavirus. As far as any medication is concerned for the novel coronavirus, there isn't any, unlike Tamiflu that is available for patients with flu.
So what things can the public do to help prevent the spread of the novel coronavirus?
So I think one of the most important things that we talk about novel coronavirus or flu or any illness is certainly washing your hands. That is the most important thing you can do. Staying home when you're sick, avoiding touching your face. So we really talk about that T-zone and making sure you're not touching your face and your eyes and nose and mouth, and really just managing symptoms and knowing when to seek care.
And as Jamie alluded to, hand washing is absolutely critical. It's a very low-hanging fruit that can be embraced by not only caregivers at Ballad Health, but also members of the general community. Hand washing is important, but the right hand washing is even more important. 20 seconds or more with soap and water. In case you don't have soap and water, you can use a standard alcohol sanitizer with more than 60% alcohol. That will work well as well.
In times like this that people tend to get nervous or anxious about these types of things, is there anything that we should know or should be thinking about as we go about our days and thinking about this potential pandemic?
I think my main message right now is we're really in a time to prepare but not panic. So, if we get into a high level of spread in the community, there's a very good chance that the CDC or the state governments could recommend community mitigation, such as canceling large events and small events and really trying to get people to stay home. So we've got this window of opportunity for people to prepare. How could you stay home for 2 weeks minimum? Really look at your stock and your things and things that you have at home. Not to go out and over-prepare but certainly just, can you make it for a couple of weeks? What would your family do? What's your family plans?
And so now is the time for all of us to prepare and to do our part to make sure that we are washing our hands and doing all those things, right?
And as Jamie said, prepare but not panic, and keep your eyes and ears open and exercise common sense, because as I said, and I keep on harping, good hand washing, there is no substitute for that. Those are things under our control, and those are the things we should embrace.
Very good. Thank you all so very much. We appreciate your time. For more information, please just visit balladhealth.org/COVID-19. That's COVID-19. Thank you. Thanks again.